This is one of the most exciting places I have ever been, and guess what? It's an orthodontist office. We're at Phillips Orthodontics. It's right across from Laney High School. This is their room where they do all the work, and I've got Dr. Phillips here with me to tell us all about it. This is crazy. This is so awesome. Thanks for having me today.
Oh, thank you for coming. Well, we wanted a place that would be friendly and make people feel comfortable. Sometimes people have anxiety whenever they go to the dentist or the orthodontist, and so our goal is to make people feel comfortable with their treatment so that they can relax and have an enjoyable experience. We want to do a great job for them with their orthodontic results. We certainly want their teeth to look good, but we want them to feel comfortable. We want to be the best part of their day, and that's something that we're constantly working on. Customer service, trying to be the best that we can and deliver excellent results also. A lot of people ask us about this room. The purpose of this room is an open bay concept, and we really want people to feel comfortable with their treatment. A lot of people like seeing other people beside them while they're having treatment, and it really puts them at ease.
And when you say open bay, it means all of the chairs are in here. All the treatments happen in here.
Right. We have most of our chairs here. We do protect people's confidentiality and privacy with their information, but we do perform the treatment in an open bay concept for the majority of people. But we do have a semi-private room if people prefer some privacy.
That's good. I can't imagine anybody not wanting to be in this room.
Right.
So doing this, does this really set people at ease? Are they in here kind of like enjoying themselves?
It does. There's a lot of psychology behind a concept like this that really puts people at ease with their treatment, makes them feel comfortable.
I think it's awesome. It's fantastic. So you are an orthodontist.
Correct.
So explain to me the difference between an orthodontist and a dentist.
Well, all orthodontists were dentists before they became an orthodontist. An orthodontist is someone that has been to school for 3 years longer than a dentist, and during those 3 years of residency I learned how to move teeth. That's what I did all day long. So my goal is to move them from either crooked into a straight position, or just depending on what their needs are, but basically get the teeth the way they need to be.
And have a pretty smile. You find smiles
Exactly,
here, right?
exactly.
All right, so you do that with several different ways.
Yes, we offer Invisalign for certain people if they're a candidate, as well as conventional braces. We have a modern style of braces.
So Invisalign means what?
Invisalign are a series of clear aligners that move a person's teeth over time.
So if you didn't want to see like braces.
Right, they're almost invisible basically.
Right,
yes.
Okay, and most people can get that in?
A lot of people are candidates for Invisalign. It really depends on the situation.
Okay, all right, what's the other option?
The other option are braces. There are self-ligating braces, which a lot of people don't know about. It's a more modern style of technology that we use.
And tell me just quickly what that means?
So the brace actually holds the wire rather than needing an old style color or a different mechanism to hold the wire. It means less friction, it means less visits, more comfort, more efficient treatment for people. But we still have all the cool colors for the kids that want that, so we definitely don't take that away from them.
If you're going to have braces, you've got to have style, right?
Exactly.
So you mentioned kids. This obviously looks like a great place to bring kids, but you do kids and adults both.
Right, definitely. About 30% of our patients are adults.
That's awesome. And you're an orthodontist and you have some certifications as well?
Yes, I'm a board certified orthodontist. Only about 30% of orthodontists nationwide are board certified.
Let's talk about your office just a little bit, because it's a pretty big building. All this is in the back, but you were mentioning to me earlier that before you even get to this room, you have a place where you take people separate, where you really sit down and talk to them. What happens there?
Certainly. So when a person comes in the first time, they come into our consultation room, and I sit down with them and really get to know them and their concerns with their teeth, because I want to really understand what their motivations are and what their goals are with their teeth. That way we can customize a treatment plan for them to end up with the results that they desire.
So when patients first get to your office, you meet with them separate from this room. Tell me about that.
We have a private consultation room where we get a chance to know a person and really listen to their concerns. And I do a comprehensive exam, and then we come up with a treatment plan customized for them so we can make sure we address their needs.
So they know they're going to get the great smile before they even get back to this cool room.
Right. We're not a cookie cutter kind of place. We really customize it based on each person's needs, and I explain to them what I envision their teeth looking like when we're done.
That sounds awesome. It sounds great. So customer service, great orthodontic care, your staff is wonderful, and all this cool room.
Definitely.
All right here across the street from Laney High School. That's fantastic. Thanks so much for having us here today. I appreciate it. And thank you for joining us on Your Hometown. I'm Randy Aldridge.